Hello, everyone, and welcome to the Arthritis Action Podcast. My name's Mark, as always, your host, and today I'm joined by Jake Fretwell. Jake is an advanced paramedic practitioner in primary care, having had roles in the British Army, NHS, and general practice, and he's currently practicing at St Mary's Surgery in Ely in Cambridgeshire. So, hello, Jake.
Hi, good afternoon.
Thank you very much for joining me today. I really appreciate it.
No, you're more than welcome. Thank you for having me.
So today we're talking about getting the most out of your GP appointment. So it's something that I know most people listening will have had some experiences in, and thought it might be useful to have someone like in the trenches, so to speak, to give a bit more insight into how to get the most out of your appointments. So first off, Jake, if you could tell me a little bit about yourself and your experience with arthritis.
Yes, I'm Jake Fretwell. I'm an advanced clinical practitioner, paramedic by background. I work with arthritis every day. I see many patients, many joints with arthritis, be it shoulders, knees, hips, lots of arthritis going around, particularly in the medium to elderly population, but certainly we can see it in the younger population too.
Absolutely. That's something we've definitely tried to make a point of several times, the fact that it's that common misconception of it's like an older person's problem or something, but it's absolutely not true.
Mm-hmm.
So let's kick off then with, can you talk me through the process of booking a GP appointment, and also what can people expect when they come in for the first time?
Yeah, so each GP surgery has their own processes. My surgery, we predominantly use an online platform, but recognise that most or some people can't use the online services, so we do open the phone lines as well. If you're using a form, you can complete everything, put as much detail in as you can. That helps the admin team process and triage and signpost. And it also helps the clinician reading it to kind of understand before they speak to you what is going on and what they could be happening. And that goes for the online form and on the telephone. Do give the admin staff as much detail as you can. It's not that they're being nosy, it's just that they want to get you the best care. What can you expect? It depends. Have you had arthritis for a while? Is this your first consultation? If it is, be expect a lot of questions. We do ask lots to work out what's going on. And again, we're not being nosy. If we ask, do you need any help washing and drying, or doing putting your washing on and things like that, so we can get an idea of how bad this arthritis or this pain is what it's doing to cause you difficulty. So what can you expect, really? So we ask kind of about the pain, any other symptoms that go with it, and when it started, if it's gradual onset, whether it's come on suddenly, whether it's stopping you doing anything, whether it's waking you up at night, or you like going for a walk, but you find that you're not walking for as long. Mentioned washing, personal care earlier, but can you do those things? Can you get your shoes on? Is your hip pain so bad that you can't reach down to get your shoes on? All these kind of things we want to know. So first of all, we'll take a history, lots and lots of questions, and then we'll move to an examination. Depending on what joint it is, whether it's your knee, we'll ask you to pull your trousers up, or so expose both knees so we can compare and contrast. Is one more swollen than the other? Is there any redness? Have you got any scars on there to indicate previous surgery? And then we'll give it a wiggle, we'll give it a move, looking at all the soft tissues, the ligaments, and then we'll do some little tests to work out whether there's any problems with the spongy bits, the meniscus. And then we'll wrap it all up. We'll kind of say, what are you expecting? Are you expecting some medication? Do you just want exercises? Do you just want information? We're there. We're always keen to speak to anyone, especially if they're having trouble with joints.
So that's actually something to thought of now. Is some people I know will be hesitant to go to a GP. So at what point do you think should someone come and see you? Like, should someone come to the surgery if is it just if they think they've got a problem, but like how much of a problem is a problem enough to warrant going to a GP?
That's a very good question. I don't think there's a hard and fast answer. It all depends on that individual person. So we in medicine we always talk about personalised care and patient-centred care, and that is absolutely true in all things. Even with arthritis, if you think you might have a bit of arthritis and it's causing you a problem, or if it's causing you pain, or if it's altering your day, absolutely come and have a chat with us. We'll go through it. We might not do something straight away. We might suggest some exercises. We know a stronger knee, for example, is a happier knee. And that's where my physiotherapy colleagues come into their own. Absolute experts in musculoskeletal cases.
Excellent. I do want to talk about those later on as well. So how long is the average appointment? Because like you've listed quite a lot of stuff there that's going to happen in it. So like the average appointment, how long is that going to last?
Typically 10 minutes. That's 10 minutes not to see you, examine you, take a history, make a plan. That's 10 minutes to do everything. That's 10 minutes for me to look at your records before you come in. Have you come in with this problem before? You've written on your online form, or you've told the receptionist that you've got some knee pain. I'll then scan your records, see if this has happened before, what we've tried in the past. It then encompasses the history taking, the examination, making a plan, answering any questions, and then writing up my notes. I'm a sniper typer, so I'm very, very slow at typing. But yeah, 10 minutes, and it doesn't seem like a long time, but if we do hone our skills to get things down. If we go over 10 minutes, that's fine. Most people would have sat in a GP surgery waiting room waiting 10, 15 minutes. It's not because we're slow or we're not doing anything or we're having a coffee. It's because we're trying to get the best care. So actually, if it does take a little bit longer than 10 minutes, that's fine.
Okay. One question I'm interested in is why are GP appointments only 10 minutes then? Because there's so much to do in that time, especially for you guys as well. So I'm not just trying to criticize at all. Just
Yeah.
why only 10 minutes? What is that? Do you know the reasoning behind that?
I don't know, in all honesty, the reason why it's 10 minutes, but what I do know that there's more scope to try and move away from them. Certainly, it's really difficult to try and get everything into a 10-minute consultation.
Hmm.
So what we're trying to do is move towards perhaps 15-minute consultations for acute problems or follow-ups. And this gives us a little bit longer, gives us a little bit more breathing space, and we can just take things at a slower pace if we need to. Some people prefer coming in, telling me, examining, telling them what we need to do, and going. And that's a really quick consultation, and that's what's best for them. Other people like to give me a little bit more history and a bit more depth, and like to ask more questions at the end. So I personally prefer 15 minutes appointments. If I can, I'll always book people 50-minute appointments as a face-to-face so I can just spend a little bit more time getting to understand the problem. So to answer your question, I don't know why they're 10 minutes. I'm sure there's some very clever people out there that can tell you it's something to do with contract, or might even just be tradition. That's something I'll probably Google after this to work out.
Same here. Same here. Okay, well, so as like that 10-minute window is quite tight considering the amount you have to do like pre and post within that 10 minutes as well.
Yeah.
Is there something like particular that people should remember to do in your appointment? Like, is there how should they best, explain to you what the issue is?
I think with modern technology, putting everything down into writing on the online form makes it a lot easier for me, because I'll then be able to reference back to that through the consultation as well. So I'll be gauging and honing into people's ideas, concerns, and expectations. So ideas, often GPs, clinicians will say, what do you think is going on? And that's not because we don't know. It's because we want to get an understanding of what you think. And if you turn around and say, actually, I've got this knee pain, I think it might be arthritis. And then that really is able us to hone in and say, well, actually, that's what they're thinking. That's what I'm thinking too. Um, or with the concerns part of it, are you worried that this pain is cancer or something more sinister? Again, I need to know that so I can either say, yeah, that's a good thought. It's something I'm thinking as well. We need to kind of exclude that. Or I could say, from what you're describing and from my examination, I don't think this is a cancer or a sinister cause. So the concerns are a really big part, and a big part that disrupts a consultation is people's expectations, and that mismatch of me either not understanding what your expectation is, and then that leads me off onto a tangent of telling you to go for physio, But if your expectation is, I've had physio already, I need some medication to help me with the pain to enable me to do the exercises, or perhaps you just want a referral. I want to know that. So then we can target the consultation to what's best for you.
Right. So, contrastly to that, is there something that people should avoid doing when they come to see you? You know, like, is almost as if like, is there sort of a wrong way to go about it, or like the wrong thing to focus on when they come in?
I think the wrong thing to do is have a second issue. Um, Coming in on the pretense of something else, but then your real worry is actually this pain that's stopping you walking, stopping you exercising. Um, we want to do the best for you. And actually, if you plug in another problem in a consultation, we probably won't do that justice. We probably won't be able to get through it all in time. In the back of our mind, we're probably thinking, we've got another couple of people that we need to see. I would love to talk about this, but I've just not got enough time. And that's a really difficult skill for any clinician, primary, secondary, tertiary care, to be able to say, I hear you, I understand that, but I don't have enough time. That's really difficult to essentially say no to somebody. Um, but it's not because we don't care or we don't want to talk about it. It's just that we want to give you the best care that we can. And to do that is focus on single issues. Avoid just try and understand our limitations. Often we can't do things straight away. We can't get that X-ray straight away. We can't get the physiotherapist in straight away. We've got lots of strain for the associated healthcare professions, such as radiographers, the guys that take the images, radiographers, the ones that read it and interpret it. The physiotherapists, there's a reason there might be a wait. That's because a lot of people need it, and there's not enough of them. It's not because they're not working. It's because we're all running flat out. So trying to understand the limitations of what we can provide in the NHS is a good idea. So try and avoid preconceptions that we're not working or we're not wanting to do the best, because we absolutely are.
Definitely. That's interesting. You say like the best approach then is just to go with one issue. So if someone has
Mm.
several issues, could they then like book a double appointment to discuss more than one, or do they literally just have to like deal with the first one first and then book another appointment for the second?
I mean, that's a really brilliant question again, and this is why it's really good to let on the online form or the platforms write what your issues are and say, I might need a double appointment for this. So if you have got two issues, you've got a cough that you've had for longer than 3 weeks and you're feeling a bit breathless, yeah, I absolutely think I'd need to deal with that. But also, if this knee pain is causing you a bother, and if you've already preempted that this is two issues, we can then accommodate that the majority of the time to say, yeah, we can give you a double appointment. So, yeah, if you think that there are more than one issue that you want to talk about, tell us, and we can potentially say, yes, we can deal with this issue today, and then the next issue tomorrow or the day after. We've got further appointments, or we might be able to say, yes, we can get this all in one. Bearing in mind that there's other staff other than GPs working in primary care. So I'm not a GP. I'm a paramedic by background, as you can imagine. Done a bit of extra training to do this
Yeah.
job. But there's also physiotherapists, first contact practitioners is their title. And these guys, having these at the front of the point of care, you might get triaged and sorted to a musculoskeletal expert. So if you come in and say, by the way, got a cough and I'm getting breathless, or I'm coughing up some blood, or I'm losing weight, that first contact practitioner is not going to be able to deal with that. So again, it comes back to that initial contact with us, be it on an online platform or by telephone. Tell us what the issues are. We want to know so we can get you the best appointment.
What about the places without online platforms, though? Because I know that, like, so you have a very nice fancy surgery that you're currently working in. As
Thank
I
you.
know,
Yeah, we're very, very lucky.
it's my local one, which is why I know what that one looks like. So,
Yeah, we've been in there since we've been there 6 months now.
it's very
I don't
nice.
touch anything, so I'm very clumsy. So I'm just waiting for something to break and to be told off.
Yeah. Well, so then, yeah, I had to use the touch screen when going in for the first time the other day.
Yeah.
And so it's something I hadn't done in in another surgery previously. So I imagine there's lots of surgeries out there that are less technologically advanced and maybe don't have as
Yeah,
much online
definitely.
access. So what
Mhm.
about people in those surgeries? Is that just from a conversation with the receptionist or something then? Or how do
Yeah,
they go about this stuff?
exactly. So receptionists, I think traditionally you would tell them the problem and they would put it on the list. But now receptionists can be called a patient services team, or they could be GP assistants. They're trained to identify issues and be able to ask questions for that issue. So yes, tell if there's no online platform, tell the receptionist, tell them everything. They're not going to be shy. They're not going to go in the staff room and say, "Oh, Joe blogs, he's got this. Did you know about that?" We're all bound by confidentiality rules. Nobody talks to anybody if we don't need to. It might be a multidisciplinary team where we sit and talk about cases, but that's in the context of clinical discussions rather than chit chat. So yeah, tell the receptionist, and if you've got more than one problem, tell them, and then they can highlight that to the team to get you the best appointment.
Yeah, receptionists are one that do come up a lot in like conversations I've had with people where they are sort of quite probably wrongly sort of noted as gatekeepers in a way, like that you have to almost convince them to get you an appointment.
Yeah.
What do you think about those those sort of things?
I think our reception team are absolutely fantastic, and we would fall apart without them. And that's
Mm.
a genuine statement. These people are great at what they do. They understand. They can pick up. If you've come to us for 20 years and suddenly there's a change, they will know about it. If a receptionist or patient services come to me and say, "Jake, I'm worried," then I'm worried too, because these people know what they're doing. Are they gatekeepers? No, actually, a lot of the time, and there's a new contract coming in that a clinician has to triage all contacts. Um, so yeah, no, they're not gatekeepers. They are just doing their job. They are asking the questions, not because they want to know. It's be it if you call in and say, "I've got chest pain." Actually, if you've got chest pain and it's crushing and you're feeling a bit breathless and it gets worse when you're walking and potentially it's going into your neck or your jaw or down your arm, you don't need to come and see us in primary care. You need to be ringing an ambulance to the paramedics on the
Mm.
big shiny yellow uh, vehicle to come and see you to be able to do all the other things that we just can't do. We're not geared up to do. It's not that they're being gatekeepers per se. Again, they're trying to get you the best care.
Excellent. Hopefully that'll put some people's minds at ease then, because I know
I
that,
hope
that is
so. I
yeah.
hope so.
It's something you hear all
Um,
too much, and like I don't, as you've illustrated, like already, I think it's just the fact that the more they know, the more that then you can know, and the more treatment you'll be able to get from it.
That's it. They're not holding on to this information. They're going to be jotting it down, writing it onto whatever system the surgery uses for the clinician to then say, actually give them an appointment with X person because they're going to be better at dealing with that. Or actually, that we've got a pre-bookable appointment this evening. That might be better for them because they're at work. So we've got, yeah, the reception team are brilliant. I'll leave it there. Full stop.
Yeah, they are indeed. Yeah, I'll stick up for your team as well. They are very nice every time I've been there.
Thank
I
you.
don't go very often, thankfully, but when I have, they've been great.
Good. I'm glad to hear it.
So speaking of questions, though, when it comes to them asking you questions, because like we've already kind of discussed how many questions a patient will be asked. What about them asking you questions? Is that something that's welcome? Do you prefer that?
Absolutely. I don't mind answering questions. I like asking questions too. But no, I don't mind answering questions at all. In my head, it shows that you've taken what I've said on board. And you're already thinking about how our plan that we've made together is going to work. Um, if you've got a question and you think, "Oh, is this a silly question?" Just ask it because we've probably heard it before. Um, am I going to need surgery? Is going to be in your mind. Ask that. Ask, do you think I'm going to need surgery? We might say, not sure yet. Let's do some investigations. But absolutely ask any question that you feels right for you. If you're playing sport, you go and play badminton, and you say, and you've got arthritis in your knee, and you say, "Oh, should I be playing this sport?" A lot of the time we might say, is it competitive? If it's competitive, that's going to be putting a lot of strain on your knees. And we might say, you might just want to hold off, or yes, play, but just do it less competitively. Um, so we can answer all these questions. And yeah, love a question.
Excellent. What do you think about like because one thing a bit of advice we've given previously is to keep like a symptom diary. So like,
Hmm.
for like, however your arthritis or any condition, to be honest, for that matter, could
Hmm.
be like, couldn't they then like physically present that to you? Like, I've got this. Is that something they can do as well?
Yes, please. Again, where on I'm plugging. I feel like I'm plugging online platforms. This is where they're good because you can put that in. Often you can take a photo of your diary and send that in to us.
Oh, cool.
Or if you're not using online platforms, if you're giving us a call, we're giving you an appointment, bring it in. I will often sit there with a patient and saying, "Looks like you got a list there. Should we look at that together?" And if it's a list of conditions, we might say, "Oh, I've probably got time to do those two, or I only got time to do this one." But having a list of problems makes it easier for me. Again, going back to the patient's ideas, concerns, and expectations, that kind of feeds into that. Their idea is potentially that I could deal with five issues. In reality, I can't. I probably deal with one and a half, or two at best within the constraints. But certainly, kind of plain English works for me. If it really hurts, tell me it really hurts. And if you can't bend down and cut your toenails, tell me. Because these things that we need to know. Using toenails for an example, if you're diabetic and you can't help with your foot care, that's going to cause you problems. So actually, I'll need to know about that because if you say, Jake, I'm really struggling with my nails. Look, they're absolutely awful. And I say, oh, you're a bit diabetic, aren't you? And you say, yes. Well, then I'm going to say, probably we should look at the joint that's causing you pain. But also, we should probably get you referred to the podiatry team so they can help look after your feet. So again, this feeds into everything, and this is why I love my job as a generalist.
Hmm.
That I can just see someone as a whole, rather than just coming in for this knee pain. Yeah, we can then think about more holistic care. To again, it's getting the best outcome and the best care for the patient for you when you come in.
I'm a big fan of list writing as well. I think it's just a really useful thing to do because one thing I know loads of people have done is as soon as you get face to face with your doctor or nurse or whoever it is, your mind goes blank with everything that you wanted to say.
Hmm.
So having it written down, like I've done this myself because my brain is terrible. It's a useless thing.
Mine too.
No one wants to hear
Yeah.
that, Jake.
Well, no, you'll see me often in a consultation suddenly spark up and type something down. Actually, I'm thinking, I'm listening to you intently, and then I suddenly think, I need to write this down because I'm not going to remember it. And this is really good detail. Um, so some people, not me, can listen through a whole consultation and remember it all and write it down in the notes. Me, I intersperse. I'll often ask lots of questions, then write things down. So yeah, list writing is really key, I think, in a consultation. Then you've got your framework, what you want to work towards, and then I've then got an understanding of what you're worried about, where this is hurting, why, when, and I can piece together what is causing a problem. And then can I always say to my patients, let's make a plan together. Let's do this. And if this doesn't work, this will probably be the next plan. And so that's me making a list already on top of your list. So a list for a list.
Excellent. Have you got any advice or tips on how to best communicate people's either mobility or pain difficulties? How do you explain it with like the most effect?
Plain English. It hurts here. It is causing me this problem. When I get up, I'm feeling a grinding. I'm going down the stairs and that's really sore. I notice that in the morning, for 20, 30 minutes, I just feel like I need to shake the joint because I'm so stiff. Plain English. Tell me what it is. You don't have to use big fancy language. That's if you ever read my notes, I don't particularly write medically. I write in plain English. And actually, most patients now have got prospective access to the medical records. So for me, I like to write lesser medical jargon because other people are going to read it.
Well, that makes a lot of sense. One other thing you mentioned as well was physios and how you have access to physios. Well, not just at your
Mm,
surgery, but other surgeries as well.
yeah,
So how and when would people get a referral to them?
depends on you. Whether you're thinking this joint is really sore, I think a physio is going to be the best person. They probably are.
Mm.
You can either come and see us and we can refer you, or say that you need to self-refer, or if the surgery's got a first contact practitioner, first contact physiotherapist, you might get triaged into their appointment slots. But a lot of the areas actually have just self-referrals without even need to see somebody in primary care. So you don't need to see a GP or someone like me. Often, if you ask the receptionist and say, "I've got some knee pain, I think I just need physio. Can you signpost me to the musculoskeletal service?" They will say, "Absolutely, here it is," and potentially jot that into your notes that Joe Bloggs has called in with some knee pain, signposted them to the musculoskeletal service. And then it all goes back to as well to your ideas, concerns, and expectations. Is is what you're thinking just physio? If it is, tell me. Because I might say, actually, physiotherapy is really good, but you're in a lot of pain right now, aren't you? So we need to get the pain under control to enable you to do the exercises that the physio is going to give you. Um, and yeah, physio is absolutely fantastic. A stronger knee is a better knee,
Mm.
and certainly just improves outcomes. So yes, it'll be uncomfortable to do the physiotherapy, and yes, you will forget to do it on some days, but that's fine. 2 or 3 times a week, building it up. A trick I've found is when you pick up your phone, for example, think, oh, I need to do my exercises. Have that as a trigger. Pick up your phone, have a look, do your exercises. Or if your TV program comes on at 7 o'clock at night, oh, that's my trigger. I need to do my leg exercises
Mm.
whilst watching Corrie, for example. So yeah, physiotherapy is I think one of the best treatments for arthritis in all stages of it.
One thing to move on to is I know that a lot of people have mentioned how like GPs will they just want to give you medication and that's
Mhm,
it, which I think we can of course say isn't true because of all the different avenues. But I was wondering if you could
mhm.
explain a bit more why sometimes they would. You've kind of touched on it already, but a bit more detail. Why sometimes you would give them medication over sending them straight to a physio?
Yeah, so I think medication has its place, and again, it's all about patient-centered care. If it's causing you so much pain that I don't think you're going to be able to do the exercises, then you're going to need some medication short term. Then the exercises, by doing those, that will help the pain. Might be a bit uncomfortable to begin with, but the more you do it, the less pain you'll get. You might have knee pain, and actually, medication might be what you need just for a short term because it's just this acute flare up. You might have twisted your knee, which has caused a bit of arthritis flare. You don't need ongoing physiotherapy. You don't need a referral to a knee specialist. What you need is some pain medication to settle that down. And there's a physiotherapy acronym called Peace and Love, which I love. It's really good. It's looking at protecting, elevating, avoiding ice, avoiding anti-inflammatories, compression. It's a really good part of it. So the old acronym of RICE, rest, ice, compression,
Yeah, I remember
elevation.
right.
There's, we've moved on a little bit from then. So certainly lots of people still use it. But yeah, peace and love is one of the newer acronyms. Peace, so P, protect, protection, avoid activities and movements that increase pain during the first few days after an injury. You've got arthritis, you've twisted your knee, and it's really painful. You need to avoid anything that's going to make it painful. You want to elevate it, E for elevation. Elevate that limb, get it higher than the heart as often as you can. A, avoid anti-inflammatories. Anti-inflammatory medication reduce tissue healing. Avoid ice because what we do want is these nutrients, these good bits going in, bad bits going out. Do use compression for C. Use elastic bandage or taping to reduce the compression. And E for education. Your body knows best. Avoid unnecessary treatments, avoid unnecessary medical investigations, and try let nature play its role. That's the initial part of it. Then the love part is load. So let your pain guide your gradual return to normal activities. Your body will tell you when it's safe to increase the load. You will know because you won't hurt. 4 out of 10 maximum of pain. Optimism. Positive mental attitude. We need this. Condition your brain for optimal recovery. Be confident, be positive. This will improve your outcomes. V for vascularization. Choose pain-free exercises to increase the blood flow. This will help the tissues, the soft tissues, the joints repair themselves. Exercise, key. Physiotherapists, they give you exercise because they want to restore your mobility, they want to restore your strength, and they want to adopt you, or they want you to adopt an active lifestyle, an active approach to your recovery. We all need a bit of peace and love, particularly after injury.
Interesting. Okay, great.
But medication. One of the things that we might suggest, if you've got known arthritis, say you've consulted with us before, you've seen a physiotherapist, you've tried anti-inflammatories, if you can take them, or you've tried the milder opiates, and you're still getting pain, we might suggest a joint injection. We do knees predominantly in primary care. One of the joints that I inject the most is a knee. Steroid injections, we've all seen the GP program where the GP injects a joint and the patient faints. Touch wood. I've never had that. It can be uncomfortable, but the injections normally got a steroid and an anesthetic in. So the steroid can take 7 days or so to start kicking in, start working. And the anesthetic will work in 30 seconds or so and give you a couple of hours relief. The steroid essentially gives you a window of opportunity to do the exercises that you've been given. So again, it's all about trying to make you as pain-free as possible. I always try and say to my patients, I'm never going to take this pain away completely. But what I am going to try and do is get it to a manageable level so you can do the things that you want to do.
Excellent. So, final question for you before I let you go. Is there a good or bad time to seek your GP's help? I mean, is there a point when someone should go and see them, or is there a point when it's just not necessary yet?
I don't think there's a good or a bad time. It's whatever time is best for you. Treatment for all conditions, arthritis included, is person specific. It could be that we suggest medication such as anti-inflammatory gels, anti-inflammatory tablets. So we could suggest physiotherapy, joint injections. We could recommend, actually, you've done all of that, you're probably going to need that joint replaced. Let's refer you to the specialist to have that consultation with them. So no, there's no good or bad time to speak to us. It's a time which is best for you when you feel like it's appropriate. Arthritis is painful, no doubt about that. I'm a very proactive person. So if you think you might have quote unquote mild arthritis that's causing you a bit of pain, a little bit of stiffness in the morning, you find that if you do a little bit too much exercise, it becomes more painful. You find that you can't quite do the things that you used to be able to do 6, 12 months ago. I want to know about that because actually, if I can be proactive and try and reduce it causing pain in your life, if I can give you some exercises myself or suggest a physiotherapist and stop that progressing and being very painful or causing a big problem in your life, then absolutely that's what we want to do.
Excellent. And finally, any last words of wisdom or advice you'd like to give to people for their GP appointments in future?
One appointment, one problem. Lists. Listen to what we say. We might not always get it right first time, but we like to make plans and ask questions. Ask us what's in your mind. If you've got questions before the appointment, write them down. Let us know. We want to know your ideas, your concerns, and what you want from your appointment.
Thank you so much. And if anyone wants to look up any more information on stuff like this, we've got loads of information on our website and a few things about, GP appointments, medication, and all the usual arthritis stuff we have as well. So you can visit us at www.arthritisaction.org.uk, or you can send us an email at the podcast if you have any questions or would like to suggest anything at all. And that's podcast@arthritisaction.org.uk. So thank you so much, Jake. That's been really interesting. I really appreciate it.
You're more than welcome. It's a pleasure. And thank you for having me.
Thank you. And thank you, everyone, for listening. Bye-bye.